Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. I'm your host and the co-author of the book Patients at Risk and the follow-up book Imposter Doctors, Rebecca Bernard. Today we're talking about medi-spas. These are clinics that offer not just massages and facials, but medical grade type treatments like Botox, IV infusions, and sometimes even liposuction. In many cases, these clinics are not owned by physicians, even though they're administering potentially dangerous treatments with lots of risks. And we're hearing more and more about patient injury and even death that is associated with some of these treatments. Most recently, a 47-year-old woman died after receiving some treatments at the Lux Med Spa in Wortham, Texas. Today, I'm talking with Dr. Alina Sholar. She's a plastic surgeon, and she's shared some of her concerns on social media about the risks and dangers of medi-spa treatments. Dr. Sholar, welcome to the show.
Thank you, Rebecca. It's my pleasure to be here.
Tell us a little bit about yourself and your background.
I graduated from medical school back in 1999, did an entire general surgery residency at the University of Louisville, and then a plastic surgery residency at the University of Tennessee. Started my private practice in 2009 and moved from Indiana back home to Texas in 2014 and have had my practice here in Texas since then.
Just to tell our audience, how long does it take to become a plastic surgeon?
The other day I had somebody actually solicit me on through email asking if I could train them, and they had failed at a nursing school. And I said, if you really want to do this, you do what I did, which was 4 years of college, 4 years of medical school, 7 years of residency, and then continuing medical education after that with my board certification in plastic surgery and ongoing CME. And she stopped right there. But I tell people it's not just because I was slow that it took this long. It really takes that long to master, to learn the anatomy, to learn how things can go wrong, and really importantly, what to do if things do go wrong.
You went to school for many years in order to be able to safely provide treatments to patients. There's the main reason is that you needed that training and that background to be safe, and there are no safe shortcuts, and we're seeing patient deaths. Now, one of the most recent incident that we've heard about is the death of Jennifer Cleveland, a 47-year-old woman that went in for some type of treatment at a medi-spa there in Wortham, Texas. We don't know the circumstances. We only know that 911 was called and that she was having CPR performed on her. And unfortunately, she did expire. She died. And so we don't know why. We do know that the owner of the medi-spa is listed as Amber Johnson, and she claims that she is a, quote, certified practitioner on her website or on her Facebook profile, but we have no idea what that means. And she has a medical director that's supposedly in charge, but he's like 100 miles away. So talk to us about what you know about this sort of scenario. Obviously, we don't know the details. We're just speculating. But what are your thoughts just when you hear about a situation like this?
Yeah, the red flags here are, first of all, this is a medical practice owned by a layperson. So problem number one, the med spas are actually medical practices defined by the practice of medicine. So you have a non-qualified person owning a medical practice. That's the first issue. Second issue is you have a medical director in name only. So this person is plastered all over their website, but is 100 plus miles away, not directly on site, not overseeing what's going on. And they themselves don't have the training to really, truly supervise this person performing these procedures. So the letter of Texas law is that if a physician delegates a certain procedure to a non-physician, they themselves have to be able to supervise and have to be able to be knowledgeable about that procedure in order to supervise that person. So that's problem number two. Problem number three, nobody in that med spa apparently was trained to do CPR, because CPR was not started until the paramedics arrived. We've heard some from the patient's family, but a lot of it's speculation, and we'll see when the coroner's report comes out what really happened. But regardless, there was just a lot of really shady shenanigans going on in this medical practice, and there was a physician that's the gatekeeper that was not gatekeeping. We have an issue, of course, with the layperson owning the medical spa, but the physician is culpable and complicit when they are allowing this to happen. Somebody's allowing their name to be used to order Botox, unless they're getting off the black market, which they could be. I'm not saying this med spa is, but could be. But somebody is, apparently allowing this to occur. And this happens all over the place. This is not an isolated incident. Even as far back as 2010 through 2011 and 12, these issues were being examined by JAMA and some of the plastic surgery journals, where we're looking at the actual incidence of non-physician providers, lay people, estheticians, MAs, nurse practitioners, PAs, doing these medical cosmetic procedures and what the complications truly were. Now, when I tell you this, it's really truly underreported because all we can look at are malpractice incidents, right? So what we know is that about 90% of laser hair removal malpractice claims are being done by non-providers. And so if there's a malpractice claim related to laser hair removal, it's a non-provider that typically was at the helm. And when physicians are having disciplinary actions against them, typically it's this situation where the physician is supervising in name only. They're not actually there at the medical spa. They're not watching what the person's doing. They're not documenting. They're not watching over things. And when you see rates for filler patients that are somewhere around 80% of the lawsuits from fillers are related to non-physicians with no physician around, this should ring alarm bells for everybody. We've known this for a decade now, and yet here we sit with the laws still the same. So with Texas 400, we actually had, in this last legislative session, partnered with great legislators that really wanted to make a difference. And unfortunately, the legislation, the bills that were proposed were not heard in Public Health Committee here in Texas for several reasons, one of which the Public Health Committee chair is not pro-physician. A lot of scope expansion bills, 20 actually, scope expansion bills were heard, but none of the pro-physician, pro-patient bills. Those bills that we proposed that would keep patients safe, those were not heard. And one of those bills in particular would have prevented this circumstance from happening. Now, physicians can have complications too. However, in a physician's hands where you're trained to know how to deal with a complication, that's a totally different circumstance than a non-physician layperson or a nurse practitioner or a PA that does not have that training and they have no physician oversight. There also are a lot of issues with enforcement. So even though there are laws on the books to prevent the corporate practice of medicine, which is when a layperson or a corporation owns a medical practice like these med spas, however, there's a lack of enforcement. And it's not so much the medical board's fault. It's really that there's not an avenue for the medical board to use to be able to alert law enforcement to get that ball rolling. And they're really overwhelmed. So there are things we can do to shore up things legislatively, but the public has to get involved in this too. They've got to speak to their legislators and say, hey, it's not just Tex 400 complaining. It's actually a patient public safety issue here that we need to address.
And I also wonder, like, maybe this is something that could be taken up by like an attorney general, because a lot of this advertising by these medi-spas indicates that these treatments are wellness treatments or, that they're very low risk. And so let's take a look at some of the different services offered by this particular medi-spa where the patient passed away, that were promoted on her Facebook page. And let's go through what some of the medical risks are. So I'll just read off on her grand opening announcement. She says, services that we will be offering in the office: Botox, 4 different brands, derma filler, IV therapy, which includes just IV fluids and then all sorts of cocktails and infusions, laser hair removal, microblading, permanent makeup, lashes, massage. Some of that I say, okay, that makes sense. But then we get into, B12 and then it says, and more. And one of the things that I want to talk to you about later on, because I don't know much about it, is this thing called mesolipotherapy. So I want you to explain more about that in just a second. But first, you talked about dangers from laser hair removal, and that's not something you would automatically think about as being risky. So explain where the risks are with that.
Sure. So for laser hair removal, for most lasers, you're going to need topical numbing. And when topical numbing is used, that's a mixture of lidocaine and tetracaine and sometimes benzocaine. And those are medications, those are prescriptive medications. But at these laser hair removal clinics, they're getting this compounded, they're putting it on the patient. They're not understanding that you can actually have lidocaine toxicity and death related to just the lidocaine numbing cream that you're putting on. So we're not even going into the whole laser burn issue. We're just talking about actual lidocaine toxicity. And it's not something a non-physician would think about. How would they? They don't know what they don't know.
If you're slathering on lidocaine cream in enough concentration, you're getting some absorption through your skin into your bloodstream. And if you use enough of it, you're going to potentially, it can cause cardiac arrhythmias. It can cause all sorts of problems.
Yes, yeah. You'll see when people come in for full laser hair on their laser hair removal on their legs, or a man with a full back, that's enough to create enough absorption through the skin that you can have toxicity from it.
And then let's talk about Botox, that if you're getting bad Botox, it's not even necessarily the correct substance, then you can actually paralyze somebody and make them stop breathing.
Yeah, they were actually using MyoBlock instead of Botox, but didn't know the difference. And 2 people died because of that, respiratory failure, because basically their diaphragm was paralyzed from Botox.
Oh my God, that's so scary. What other things can go wrong with Botox?
Blindness, and that's something that's underrepresented, underappreciated. You hear about it more with dermal fillers, but it can actually happen with Botox as well. So if you have somebody injecting, they have no idea of what the anatomy is. They think they're just sticking in some Botox. But blindness can actually happen. Then things that are just temporary, like an eyelid droop or a brow droop. Okay, that we get it. But those big things that can really happen that are serious are very underrepresented in the med spa space. They kind of shuck them off. You may have seen it here in Texas. There's a company that's advertising that anybody can do Botox, and they literally have these 2 girls saying it's no big deal. It is a big deal. It's a very, very big deal. And they're advertising, hey, anybody can do Botox. We'll give you a medical director. Again, these physicians that are complicit, that are acting as medical directors in name only, physicians, I am telling you right now, you are a problem. So it's not just the layperson's the problem, it's the physician and gatekeeper that's the problem. We have to get these physicians ethically, morally doing no harm.
It is a medical ethics issue for me. And sometimes people criticize me because I get really vocal about some of this stuff. In particular, I'm really an opponent of this IV infusion stuff. Talk to us about these elective. I'm talking about a person that's really fine, or maybe they're a little hungover. I'm not talking about a person with a chronic disease or a legit vitamin deficiency. I'm talking about oh, I'm told that if I get this vitamins, I'm going to feel more vitality and healthier. And what can go wrong with that?
Could have an air embolus if the line isn't primed. That's a possibility. Whoever's mixing this cocktail may not understand what they're mixing. There have been instances, I know there was one in Louisville, Kentucky, where a patient actually had vitamin D intoxication and ended up with kidney failure permanently. There are some things you should not push IV. And if you're not a physician, you may not know that. Of course, kind of longer term complications. If you overload a patient with fluid that has congestive heart failure, you're going to be in trouble. IV infusions aren't innocuous, and I think that's what the public doesn't understand. Yeah, you may think you need an IV after a hangover, but in actuality, if that's the case, a physician needs to be there to actually medically evaluate that patient, to ensure that patient is safe to get that particular IV fusion, and they are watching over what's exactly going in that IV fluid bag. But in most cases, you have a lay person, maybe an RN, mixing up this cocktail, putting it in an IV bag. Nobody's there to evaluate this patient, and they are patients. They are not customers at an IV drip bar. There's nobody watching. It's unfortunate that this poor woman died, but I hope this brings some public awareness to the fact, first, that med spas are out there that are operating really outside the letter of the law. 2, that the law should be shored up to ensure adequate supervision, but also that the IV therapy is not necessarily an all grand and safe venture, that you really have to have a physician there watching.
Yeah, 100%. And, sometimes people will say, well, if the patient consents to it, but I don't think that these patients are getting true informed consent, because if you were, you would explain to them the benefits, which are almost none, the risks, which
Right.
are there. And so, when it comes to medical ethics, and speaking of supervising physicians and the doctors out there that are offering these types of products, and I know they will try to tell themselves that, well, I'm trying to help somebody, but you got to look at the medical ethics of beneficence and non-maleficence. And, are you potentially harming someone with this? Even if they feel subjectively better, you're the expert and you know that this is not scientific and that this is not right. So, I just think we really need to stop thinking about making people happy when what they think might make them happy could actually hurt them or even kill them. Dr. Sholar, talk to us
Yes.
about mesolipotherapy. I've never heard of this. And on this MedLux, she's selling this. She has a weekly specials, and it says one vial, $450, three vials, $1,275. And it says, I don't even know what it is. There's a picture here that shows different parts of the body. It looks like theoretically it's supposed to melt fat or something. Tell us about that.
There is a legit way to do this, and there is a non-legitimate way to do this. The FDA approved version of mesolipotherapy is Kybella, and Kybella is basically a fat emulsifier, and it's meant to be used in small areas. It's a prescriptive medication. So again, it needs to be under the direction of a physician. Now, I am going to venture to guess, because they're calling it mesolipotherapy, they're probably not using the brand name Kybella. They might be using a compound from a pharmacy or from somewhere else. These cocktails from mesolipo that are injected underneath the skin into the subcutaneous fat, often blends of deoxycholic acid, phosphatidylcholine, hyaluronidase, and have a lot of caffeine for a vasodilatory effect. When you are injecting a lot of caffeine into a subcutaneous, have some cardiac arrhythmias from this, along with some of the other things that they might be cocktailing in there. So I'm wondering if this mesolipotherapy she's advertising here, because she's not using the brand name, is probably a compound from somewhere. Which brings me to another point. At some point as well, the pharmacies that are supplying these lay people with medications that are prescriptive medications need to be held accountable. Medical device companies that are selling lasers to lay people and not physicians need to be held accountable.
I imagine that a layperson is going to be a lot less skeptical about some of these claims. If I'm a salesperson and I'm interested in making some money, I could go to you and you're going to ask me a million questions about my laser product. You're really going to hold my feet to the fire to make sure that it's safe. And you're not going to buy it if you have concerns. Whereas someone that may not have that knowledge and that insight might be just really impressed by what they hear. Of course, they're going to hear dollar signs. So if I'm a company like that, if I'm not holding myself to higher ethics or required to by law, then why wouldn't I go to those kinds of people to try to sell my very expensive products?
They go for the low-hanging fruit, those that are not educated.
Well, you're doing amazing work legislatively and also with advocacy. And then your social media post that's been shared all over the place. I shared it, and I know a lot of my colleagues have shared it. What you say here is that patients need to be aware. Although it is illegal for a layperson or anyone other than a physician to own a medical practice, and you point out a med spa is a medical practice, it is a very common occurrence and it puts patients in harm's way, just like this recent unfortunate event. And you're urging patients to make sure that if you're going to go to one of these medi-spas, that there is a physician truly overseeing the practice. Make sure that you know the credentials. Like, for example, Amber just calls herself a practitioner, but what the heck is that? We don't even know if she even has a nursing background. Is she a nurse practitioner? We don't know. A practitioner means nothing to us. So you need to look for credentials. That means those letters behind the person's name, MD or DO, that means physician. Or are you seeing NP or RN or nothing? You need to know what that is. And, really you need to put your safety as a top priority. These are medical procedures, not wellness products, which is what really I think is such an important message that you've given.
And I think the other point here being that the term med spa, encompasses a lot, but we also see the same problem with cryotherapy clinics and ketamine clinics and weight loss clinics and low testosterone clinics. Now regenerative medicine and stem cell clinics. So you'll see a lot of wolves in sheep's clothing, these medical practices that are really disguised as being these innocuous wellness ventures, but in actuality, they're practicing medicine.
Yeah, basically, we need to have a buyer beware philosophy, because we obviously at this point cannot be sure that any authorities are protecting us. So we really need to go that extra mile to protect ourselves. What I would say, which I always tell patients, even if you're seeing a physician, get a second opinion, especially before you're going to have something injected into your body or a surgery, unless you're very, very confident with the physician. Certainly if it's a non-physician, you really need to see a doctor and get a second opinion before you enter into anything that might have potentially life-threatening risks.
Yeah, definitely buyer beware. We need some public support to get these legislative changes to happen. In the past, physicians have really been too quiet on this issue as well, where they kind of want to hang back. They don't want to tell on other physicians. Well, now's the time to speak out. If you're an ethical physician, you need to be on the forefront with this here thing and not being afraid. I understand completely where people are coming from, where physicians are coming from, saying, "Oh, I'm going to get repercussions from the nurse practitioners. I'm going to be doxxed by the PAs." It doesn't matter, okay? And I'm really 100% firm on the. I understand that you're scared, but that's why we're here as an organization at PPP and Texas 100. We're here to support physicians who want to stand up and do the right thing and speak out publicly about it. I've been doxxed. Heck yes, I have. I've had our office and complain about me and gripe at our staff, but that's okay, because I'm on the right side of this issue here. They can harass me as much as they want, but the fact is, all of us physicians, this is what we're supposed to do, not just see patients every 10 minutes of the day. Our job as a public health expert is to ensure that every patient is safe, not just those we have a physician-patient relationship with directly, but that all physicians are safe. So physicians, come on now. It's time to get this game. We have to stand up against what's going on here.
I love that so much. And yeah, I mean, talk about doxed and hate mail. I get regular emails telling me, F you, go F yourself. You're arrogant. You're narcissistic. You hate, all this really ugly rhetoric that comes to me just simply for speaking out. But you know what? Despite all that, none of that has actually hurt me professionally. So I know people are scared, but the worst thing that you're going to get is some ugly messages from people. And guess what? You're also going to get some really supportive messages, which are going to be NPs and PAs who agree and believe that we need to have physicians leading healthcare, from patients that say, "Thank you for letting me know so that I can make the best and informed decision." So don't be afraid of some hate mail. You're tough. You can handle it. So, well, thank you so much, Dr. Sholar. Thank you for joining me, for your advocacy, for your fighting and spirit, and for your care of patients. I really appreciate it.
Thank you. Thank you so much for having me on.
I hope you've enjoyed this podcast. If you'd like to learn more about the topic of non-physicians in healthcare, please get my books, Patients at Risk and Imposter Doctors. Both are available at Amazon. And if you're a physician and you'd like to learn more about getting involved in our mission, which is advocating for physician-led care for all patients and truth and transparency among healthcare practitioners, please join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org. And if you like this podcast and you have an idea for a topic or you'd like to appear on the podcast, please send me an email. You can reach me through my website, patientsAtRisk.com. Thanks so much, and we'll see you on the next podcast.